Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF. Y, 616-9535. Unit 5, Identify, Assess and Control Health and Safety Risks. Enhanced Limited Copyright 2019. Carrying out an inspection. Before you carry out a health and safety inspection, you should make sure you are fully prepared. Are you up to date with current legislation? For example, HSG 65. Do you have access to previous inspection records? Do you have access to individual health and safety or maintenance records? Do you require specialist assistance? Do you require specialist equipment? Identifying hazards. Observation. Walkabout. Formal and informal inspection. Interview. Consultation. Analysis of existing data, including accident/incident records. Use of monitoring equipment. Evaluating hazards. Once the hazards have been identified, they need to be analyzed to identify the risk. Impact is the severity of the harm the hazard will cause. Probability is the likelihood that the hazard will cause harm. Selecting the appropriate equipment. When identifying risks, sometimes you need specialist equipment. These can include personal protective equipment, PPE, hard hats, high-visibility clothing, protective eyewear and dust masks, PAT testers, decibel meters, voltage testers, ladders, chemical testing kits. Recording your findings. After completing the inspection, the information can be recorded in a risk assessment. Other accompanying documents could include inspection records, minutes, data sheets, interview notes, photographs. Conducting a risk assessment. Hazard, overloading plug sockets. People at risk, employees, visitors, contractors, nearby residents. Risk level, orange. Risk control methods, 1. Spread power use across all outlets, not just overloading one socket. 2. Ensure that all employees are trained to use electrical equipment safely. 3. Switch off and unplug unnecessary appliances. New risk level, green. Actioned by office manager and employees. Date of assessment, 18th of July 2019. Hazard, slips, trips and falls. People at risk, employees, visitors, contractors. Risk level, yellow. Risk control methods, 1. Ensure all stairs and walkways are properly lit. 2. Ensure all stairs and walkways are clear of hazards, cables, debris. 3. Replace any faulty flooring. 4. Ensure any spilt liquids are cleaned up quickly and efficiently. New risk level, green. Actioned by office manager, employees. Date of assessment, 18th of July 2019. Who is at risk? It is important to recognize who is at risk so you can develop control measures for every scenario. Who is at risk is dependent on environment. For example, if a workspace is a detached building, only employees and visitors are at risk. However, if the workspace is in a shared building, then others in the building could be at risk. Prioritizing risks. When developing control methods, it is important to prioritize risks. The more severe the risk, the sooner it should be dealt with. For example, if one hazard is life-threatening but expensive to rectify, it should be prioritized over a small hazard that is easy to fix. When implementing control measures, budgeting is essential, but health and safety is the primary concern. Risk control measures. Risk control measures are the actions that are put into place to remove or reduce the risk of a hazard. These measures can relate to people, equipment, environment, policies, procedures. The most effective risk control measures are those that have been developed after a thorough analysis of the data gathered and previous records. Resources required: time, manpower, access to specialist people, Access to specialist equipment. Measuring effectiveness. Cost versus benefit. Time taken to implement. Feasibility. Training of those involved. Analysis of data gathered, and previous records. Hierarchy of control. Elimination, remove hazard. Substitution, replace hazard. Engineering controls, isolate hazard. Administration controls, manage behavior. Personal protective equipment, PPE, protect people with PPE. Maintaining risk control measures. Check your risk control measures are working. Maintain staff training. Frequently review accident book. Review all new equipment, substances and procedures. Communicate with employees and visitors. Keep up to date with statutory requirements and industry best practice. External factors. There are a number of external factors to consider when completing a risk assessment. These can include UK legislation, requirements of professional bodies/franchises, customers and others who may be affected, changes to materials used in production process, location, access to emergency services. Level 6 NVQ Diploma in Occupational Health and Safety Practice, RQF.